Hello, my name is Dr. Sarah Brown. I'm a children's respiratory consultant in London. I look after many children with complex respiratory conditions, including asthma, and I've been asked to give this short video about vaping and the use of e-cigarettes in children and young people generally and in the context of asthma. So I'm sure you've seen in the media recently that there are more and more people taking up e-cigarettes and vaping, and you've probably also seen that in normal day-to-day life as well. And we know that there are many more children and young people using vape devices and e-cigarettes than there have been in the past. And e-cigarettes and vape devices are largely made by the tobacco industry, so that means the companies that make conventional cigarettes. And these companies over the years have been very good at promoting their products and making them enticing and attractive for children and young people. And e-cigarettes are no exception with their bright colours, flavours and packaging. And while sometimes the messages around e-cigarettes and vaping are a little bit confusing, we as children's doctors and children's respiratory doctors worry about children and young people generally, and those with underlying respiratory or chest or lung problems vaping for a variety of reasons. And the first is that the vast majority of these devices contain nicotine, and nicotine is a drug of addiction. It's what is in conventional cigarettes and is the reason that people find them hard to quit, and is also the reason why it's hard to quit using e-cigarettes as well. And nicotine has different effects on the bodies and the brains of children and young people compared to adults. It affects your brain development and function, it affects your heart, it affects your blood vessels. And we know that children and young people get addicted to nicotine much faster than adults. So using e-cigarettes and vaping, even just experimenting and having a go, can lead to addiction. And once you're addicted, it can be incredibly hard to stop. And so the other area that we worry about is that if you're using e-cigarettes and vape devices and you're addicted, whether that may then lead on to using conventional cigarettes, which I think we can all agree are universally bad for your health. The second area that we worry about is whether or not they contain nicotine. All of these devices contain chemicals in some form or another, and we don't know about the long-term effects of those, and we worry about that aspect, and we also worry about the acute effects of those kind of chemicals on the lungs. So you've probably heard about cases where people, including young people, have been admitted to hospital with severe lung problems because of vaping and e-cigarettes. And a lot of that has been in the United States, where the regulation and some of the components of e-cigarettes are different. But there have been cases in the UK and Europe of people and young people getting significantly unwell because of vaping. And then the other concern are the long-term effects. So once upon a time, many years ago, doctors said that using conventional cigarettes was good for your health. And I think nowadays we can all say that's ridiculous. And we know that because of years of collecting data and looking at the long-term effects of smoking. And in many ways, e-cigarettes are similar. It's going to take many, many years to know what the long-term effects of these devices are on the lungs. And we worry that some of those effects may be different in children and young people where their lungs are still developing, and if they're using them on a more long-term basis. And we worry that maybe in years to come, many of those children and young people will have lung disease or other health problems from having used e-cigarettes and vape devices from a young age. For asthmatics and anybody with an underlying lung condition, we worry that inhaling e-cigarettes or vaping may cause more damage to their lungs, either in the short term or the long term. And we know there are many asthmatics where inhaling certain chemicals can make their asthma worse, can make it more difficult to manage, can lead to acute asthma attacks. And we worry that this may be the same problem if people are using e-cigarettes or vaping. And then the other area, which is maybe something slightly different to think about, is the environmental impact of vapes and e-cigarettes. So the disposable vapes that you often see littering streets and parks are the ones that are preferentially used by children and young people. And they're very hard to recycle. They generally contain lithium, and this is mined from the Earth's surface, and causes environmental damage through the mining process. So generally all round, these devices are really bad for the environment. So those are the reasons that we worry about children and young people vaping. The nicotine and addictive component to them, making them hard to quit, and the effects of nicotine on the body, and the potential short and long-term effects of the devices on the lungs, generally of children and young people, but particularly in those with an underlying lung condition such as asthma. And finally, we worry about the long-term environmental impact of these devices on the earth for many years to come.